Sahani sir and all those who participate in this session. Good morning, good afternoon, and good evening. Welcome to the 1504th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for 1 minute. Thank you and welcome back. Today we have with us Dr. RAKSHA THAKKER, BHMS CCAH, Chief Physician, Inner Veer Savarkar Marg, Thane, Mumbai. She guides the budding homeopathist and doctor practitioners through her Initiative Homeopathy Advanced Learning Center, comprehending rubrics through case presentation, easy art and science with complete understanding. The topic is understanding subtle nuances of psychological effect of insecurity in an individual through case presentation. So on behalf of IFPH, and welcome Dr. RAKSHA. You can have the platform for the next 45 minutes. It's over to you. Please proceed.
Thank you so much, sir, for the lovely introduction. Greetings of the day to one and all, and my gratitude to Dr. Shani sir, Dr. Bob sir, Dr. Sajid Puda sir, and Dr. Dhanesh sir. It's always Dr. Dhanesh sir is, Madam, I need the date from you. When are you presenting? And just prior 2 days back, he told me, I said, okay, I am ready. You just tell me when I have got to present. 13th October, 8:30 p.m. Okay, fine. Just 2 days back. And I said, I won't be having the PPT ready in such a short notice, but I will definitely join in. Okay. So, sir, shall we begin?
Yes.
We are waiting for the delegates to join in.
No problem. We can.
Okay.
Precision is our specialty, always at 8:30. Yes, please.
Okay. So, this is the case of a female, 60 years, with anxiety neurosis, fear, and sleeplessness. She had insomnia problem and negative feelings, highly pessimistic. Okay. And she had the fear. She couldn't enjoy life, is what she says. Okay. So, husband is a heart patient and heart patient since 2 years. Patients feel, what if he dies? How far will I survive alone? Husband takes care of me, tolerates my tantrums. So you can imagine how this lady is. Tolerates my tantrums. Husband has undergone bypass surgery. In spite of bypass surgery, the husband is tolerating this lady, temper tantrums. Okay? And I cannot tolerate pressure. So after I got promotion, I took voluntary retirement. In spite of promotion, we have been promoted. At that time, you must not take voluntary retirement. But this lady couldn't handle the pressure, and that is the reason why she took a step back, and then she took voluntary retirement, VRS scheme. Why? Reason, boss expects more from me. Okay. So the expectations of boss are more, and I feel tremendous pressure. So I took VRS, that is voluntary retirement. I can't tolerate anyone saying wrong things about me and people pointing my mistakes. I get angry. If I can't shout at them, I get this insomnia. If I can shout, then I'm okay. I dominate my husband. At job, I can't dominate, so I left the door. Okay. Husband tolerates my anger, takes care of me. I have negative feelings. Nobody tolerates my anger. My husband is my everything. Husband's brother died of heart attack. Okay. So this lady now, as the topic suggests, we have given the topic for today's cases, insecurity, tremendous insecurity to this lady. Husband's brother died of heart attack. My husband is having heart problem, has undergone bypass surgery. What if I am alone? How will I survive now? So this is the main issue of the case. And 1 year back, my daughter was pregnant. So I was fearing that she should not land into any complication. I don't have fear for myself. Daily, when I watch TV and newspaper, all bad incidences about women I see. I can't stay alone. Anxiety, sleeplessness creeps in. I don't have a problem, but my daughter forced me to come here. Sister expired earlier. While saying this, the patient was crying while narrating this that the sister expired. Maybe it could be, doctor, that after my sister expired, I am having this fear. In office, I'm very talkative. I want people around. I can't stay in Mumbai due to this. As in Mumbai, people are into themselves, but exceptions are always there. So, someone finds fault, I don't like it. I expect a lot. I love too much. I feel that way for my daughter. I loved my daughter. Now, you understand the psyche of this female, okay? She wants that the daughter should get married in Kerala. Be besides me. You are imposing your thoughts on the daughter. Daughter herself has got her own life. I had lots of dreams for my daughter that she should marry in Kerala, but daughter did love marriage. She went against me and she did love marriage also. Okay, then later on we got her married, but the thing is, I wanted her next to me, near by to me in Kerala. Okay, but she married, love marriage she did. I thought different for her. I wanted her to marry near me in Kerala, but she broke all my expectations. She broke my heart and my dreams. She is away from me. That is the problem. Only I take the decision of the house. Anything is to be decided, I take the decision. Husband doesn't take any decision. I like buying gold, but I spend only on need and only on occasion. Quality is important for me rather than price. Now, I spoke to daughter. Okay, heard about the patient. Now let me see what the daughter has to say about the mom. Okay, then daughter's feedback. Mom is very caring and concerned about the health of the family members. Fears about the same, fears about the health, and is concerned about the health of the family members. Sincere, working, then ego related issues she has. She does not like fault finding. Anybody pointing out to her, she will not like that. But she herself keeps on pointing out all sorts of mistakes, censorious, critical this lady is. She put efforts that she does not like anyone telling her that she is wrong. You must not pinpoint, but I can pinpoint. I can make a list of all the mistakes that you all have made. But when it comes to my mistakes, don't point out. She cannot take failures. She finds a person to blame every time she wants to keep on nagging. Okay? Feels no one will take care of her. She will have to do everything on her own, and in later stages, she has to take care of herself. So, this is basically the entire case. No doubt it was a very long session, like 3 to 4 hours, but taking into consideration the time, I have given the gist of the case. So, I summarize again that this lady, husband has got heart attack, husband's brother died of heart attack, daughter was pregnant, she had that insecurity that my daughter will land up into complications during delivery. She can't stay alone, a very miser, avaricious person, and she spends on gold, but she uses it only occasionally, and she wants quality rather than quantity. Also, she wants, yes, quantity as well as quality, but more preference is given to quality. Daughter's feedback, she is caring, yes, but she doesn't want anybody pinpointing on her mistakes. She left the job, and due to tremendous pressure, she couldn't handle that, and she took voluntary retirement, VRS. So this is the crux of the case. Any remedies you all can think of? Any incidents, any news on the TV? She is scared. Anyone? Highly angry persona, dogmatic, dictatorial. Yes, sir, anybody has come up with any rubric or remedy, or should I disclose?
Not so far.
So it is none other than our arsenic. So arsenic was given to this lady, a fastidious one. Fastidious means hard to please. Whatever you do, it is very difficult to please that personality. And the rubrics which were chosen for this case was ailments from death of loved one. Sister expired. He even was crying while narrating that incident. Then we have anxiety, family about his avarice. Avarice is the person who keep on accumulating. She wants gold, she wants this, she wants that, and everybody should be working according to her way. It is either her way or highway, either my way or highway. And anxiety, family about his avarice, censorious, critical, fault finding. She will be finding mistakes in opposite person, but when it comes to herself, she doesn't like that. Understand the psyche of the patient. And delusion, man does all the thing he does. There is a rubric in synthesis. Delusion, man does all the thing he does a man. Meaning, what this lady said, what was her version was, I take entire decision of the house. Usually, the male counterpart takes the entire decision, but here, this lady is taking the entire decision of the house. So, I am the man. Delusion, man does all the thing he does a man. She being the female, there is male in the house, a male counterpart is there, still this female wants to take the decision of the house. So she wants to be a man. So we have a rubric in the synthesis repertoire. Dictatorial. She is dictating her terms to the opposite person. Do this, don't do that, do this, don't do. I told you this is not the way it has to be done. Don't you understand that? This is what this lady does. Okay? She is highly fastidious. And fear knows cut off. Fear knows cut off. There is a rubric in synthesis. Meaning, my daughter got married and it was a love marriage. So, my nose got cut. Meaning, the nose is your image, your dignity. Now, what will I tell to the society? Society will keep on asking me, oh, your daughter got married, love marriage. Oh, very bad. You should have imbibed good values, good ethics, good moral values. What your daughter did? She did love marriage. Very bad. This is what usually the society says. Now, when the society will point out at me, what answer will I give? So, fear knows cuts off having the nose. My image, all the credibility, all the good value system, all I have earned these years, all went in drain. My daughter got married, a love marriage. Okay. So all the goodwill which I earned all went in drain. Now we took one rubric, impressionable. Impressionable. Why impressionable? Because when she is watching such scenes on TV, she is getting scared. So there is a wonderful rubric, impressionable. So I would always cite, and I today also I want to cite my daughter's example. Okay, my daughter's name is Navya, and there is a movie, Singham movie, and the actor name is Ajay Devgan. So Ajay Devgan Singham movie, and there is a dialogue, Atta Maji Satkele. So Navya was playing, my daughter was playing. I said, come, let's have lunch. Mama, have you seen that movie Singham? I said, yes, I have seen. Ajay Devgan uncle, Atta Maji Satkele. So this is the dialogue which he says. So that actor indirectly has influenced Navya, my daughter, and Navya was impressed by the dialogue. So when impressionable is a stamp, when a paper and you take a stamp and a stamp impression on the paper, that is impressionable. It leaves an imprint on one's psyche, on one's mind. Okay, the impressionable was the rubric taken. Now, reproaching others. Do this, don't do that. Why you did this? Always blame me. So reproach means blame. Okay, so we had arsenic being given to this patient in 1 potency and repetition again 15 days. So and this patient was all fine. Now the insecurity, it was the insecurity which was talking that my daughter has to be beside me. The reason was during my old age, the daughter will take care of me. So I want to impose my thoughts on the daughter, marry near me, be next to me in Kerala. Okay, so this is it. Now we will be studying arsenic. Okay, let us see what Stalwart wants to say. Sir, anybody has doubts in regards to this case, kindly let me know. Any points they want me to elaborate?
Our usual custom is to have discussion after the presentation.
Okay, okay. So, gold-headed cane patient is read and written by Dr. Herring. Gold-headed cane patient. So, arsenic patient wants everything clean. My image should not be spoiled. My reputation should not be spoiled. But when you see the drawers are all messy, she wants everything clean, but inside the drawer it is all messy. Okay. Then there is another rubric. I have taken all the rubrics, sir, from synthesis repertory. Okay. I usually use synthesis repertory. A despair salvation of. Now, Bob sir has already joined. So, Bob sir, in Christianity, it is that according to your deeds, we on the judgment day go get eternal life and eternal hell. So, despair of salvation. I won't be getting salvation if I do bad deeds. So, despair. Despair means loss of hope. So, arsenic patient feels that I have done so many bad deeds that now I won't get salvation. I won't get eternal life. I will have to go to hell. So, this is it. And there is one word. There is one word we need to mark and underline that. Aggrandizing nature. Now, what does aggrandizing nature mean? So aggrandizing is to keep on collecting, keep on accumulating. Arsenic keeps on accumulating. I have got gold, doctor, but I use it only occasionally. So when you have got gold, in different occasions we usually like to wear, but she keeps on accumulating and she uses it only occasionally, and I don't spend much money. There is a word parsimonious in Kent materia medica written. Parsimonious will they will think 100 times before spending money. Okay, desires more than needs. Doctor said for your health you must walk 45 minutes. Arsenic patient will walk for 2 hours. Doctor told me, but doctor told you to walk for 45 minutes and that is sufficient. No, no, no. It is good for health. No, let me walk for 2 hours more. The biting tumbler. I want hot water. Mama, okay. So much hot water. Make it lukewarm. Okay, fine. Now add little bit of hot water. You don't understand what temperature I want. First you gave me very hot. Then now I wanted lukewarm. It is not that lukewarm. I'm not getting the water. I'm not getting the temperature correct. The water which you have provided is not according to the temperature which I want. The one who is serving arsenic will be fed up. Please, I cannot anymore serve you now. Okay. So arsenic theme is there is a feeling of defenses being weak. They feel that there are thieves, there are robbers in the house, and the robbers are none other but my family members who will grab all my property. Okay. So, and if you see the periodic table, arsenic belongs to the mineral kingdom, and moreover, arsenic belongs to row 4 of the periodic table. So, row 4 is the main theme is work, house. They are more bothered about that, the materialistic aspect. So, in this case, also arsenic is more bothered about the materialistic aspect to the level that my daughter must marry next to me in Kerala. We residing next to me, so that during my old age, I have my daughter beside me to take care of. Row 4, column 15 is arsenic. Okay. Now, a very, very nice point mentioned by Boric sir. The Boric sir says arsenic, when given twice an easier to last movement of light when given in high potency. Okay, so for a peaceful death, usually high potency, the vitality is low. We give low potency, but when we want peaceful death, we can give arsenic in high potency so that they can have peaceful death. And the patient who is in agony, they need not suffer more. There is another rubric in synthesis repertory. Rest cannot until things are at the proper place. So they are so restless that the thing has to be in the proper place. If a book is taken out from the library, it has to go in that same section properly placed. And to the extent they will keep searching scissors and they will see that whether their kids' nails are actually trimmed properly or they will keep scissors ready in the first and they will keep on checking. Then the drawers they will cross their fingers to check for dirt. So much is the facetiousness, and when this facetiousness goes to the pathological level, it turns to OCD, obsessive compulsive disorder. Obsessive compulsive disorder is nothing but your pathological fastidiousness. All the rubrics in the repertory mentioned are morbid. Meaning of morbid is they are not balanced. So there is a rubric cheerful as well. Now what is the harm in being cheerful? But it is not balanced. It is out of proportion. That is the reason why they are listed in the repertory. We consider the repertorial totality and prescribe the medicine. In the follow-up, the rubric which you have chosen, the patient has to be better, and that rubric When you ask the question related to the rubric, patient may say, yes, I am better. I feel better. Because you have chosen the remedy through that rubric. Now the rubric has to be cancelled. But after giving the remedy, the follow-up, then the rubric must be cancelled. So that means your remedy is working properly. Now, what is it? The first sign which will be a confirmatory test that your remedy is working. Sleep, adequate sleep. The patient will sleep properly. Then the appetite. There will be increase in appetite. Okay. Then the generals will be better first. Later on comes the mentals, physicals. Okay. So when the generals are proper, you are damn sure that your remedy is working. Usually, we tend to repeat. It's not that I don't say that don't repeat. Perseverance is our part to wait and watch. Usually apply wait and watch policy, because when the remedy is working and interference of another remedy, then maybe you may spoil the case as well. But when it is required, yes, I do repeat. Okay, so this is trust. And when we read Philip Bailey book, Philip Bailey sir says he gets to the core of the will and heart of the patient in reference to context where he says that I ask the patient, what is it that you want to change in your personality to go to the will of that patient? If the patient is actually willing to change his personality, because that is the sole reason why the patient has come to you. So you can go to the core. You can go to the core. Usually what happens in various groups when I share the cases, we are at the periphery. We need to zoom in, go to the core level to reach to the patient. Core. When it comes to core, for simple understanding, the earth core, the core of an onion, layer after layer, you get the core. Okay, and the patient is asking from you nothing but energy. Like we did the experiment even in science. Prism was taken, we placed it on the table, and the rays of the sun entering the prism, we have the rainbow colors on the other side. Okay, so they also vibrate. The colors also vibrate on a frequency. Backflower, I'm backflower therapist. The flowers also vibrate in a certain frequency. So when they say that you vibrate on a same plane, then you are able to comprehend what the other person wants to say. And basically, it is, as we say, that we need to vibrate at a higher level with higher consciousness, is what they usually say. So this is nothing but the wavelength and frequency, because the patient is feeling low, has come to the physician so that the physician gives homeopathic medicine in the form of energy. And how do we derive this energy? Through dynamization, potentization, percussion, and titration, wherein the kinesthetic energy is released. Okay, so this is it. And hereby, I would like to know the audience feedback and any question, any query related to the case, apart from the case, and any point they want me to elaborate, kindly let me know. Thank you. Thank you, everyone.
Thank you, Dr. Raksha. Nice presentation that indicates how much effort a physician needs to take in order to cure a case. That's
Yes,
a
sir.
domain of
Sir,
homeopathy. Yes, please.
sir, it so happens that usually when we prescribe, okay, and we feel our work is done, actual work starts later also. When we give retrospective study, we read through the book, what the Stalwart. So tremendous dedication that Stalwart study has, and we must not miss reading the books of the Stalwart. That is what I want to convey through this message. The take-home message is this. Thank
Yes.
you.
Time for discussion. Those who would like to participate, please raise your hand. You can ask some questions or you can add something, because we all know that every case is totally different from other cases. That is why when somebody asked to Schmidt, do you have any experience treating asthma cases? He said, frankly saying no, because each and every case is totally different. That's the answer given by Schmidt. So that's the importance. You can have your own ideas, you can have your own experience. Kindly share with Dr. Raksha.
Psychological impact.
Yeah.
Psychological impact on the patient is due to the circumstances, and we need to consider that. Like, say, arsenic, when we give to this patient, day one, if he or she is not arsenic, it is the circumstances, and because of the circumstances having grave impact on the psyche. Like in this case, this lady got insecure. Why? What if my husband dies of heart attack? Her brother also died, husband's brother, sister also died, and now the daughter also left me. Did love marriage. So, how much insecurity creeps in? And the middle kingdom, the electronic configuration, the outermost orbit has to be stable. So, where does my stability lie now? When everybody are leaving me, how will I be stable? How will I be stable? This is the main crux core point of this case. So the topic which I gave is understanding psyche insecurity through this case. And I hope I've been justice to the topic.
Yes. So all these things are possible because of the potentialization. Otherwise, it is not possible. You will not get any arsenic mental symptoms or this psychological symptoms or the physical journals until and unless we have potentialized medicine. So potentialization is an important factor. Moreover, the infinitesimal dose that also makes this evolution possible. Without this infinitesimal dose, homeopathy will not work. Without potentialization, homeopathy will not work. Without the individual symptoms, homeopathy will not work. So these are in fact, the Hahnemannian real contribution to the medical system. What about the potency in the case? Which potency? Arsenic album. Am I audible, Dr. Raksha?
So it is the sir,
Yeah.
it is the grievances which the patient share. Okay. So when we are taking the case, and this case, like, see, now I have shared. It is half an hour, 45 minutes, 1 hour. But when we are actually taking the case, at times it goes till 4 hours, 5 hours also. It depends upon how the patient will open up the vent, no? So this is it. So that is the basic thing which we have to consider. Let the patient speak. But if you feel that the patient is drifting, going off track, then get him on track. So when we are sharing on the social media, the entire thing I have almost narrated one, but this case went on till 4 or 5 sessions, for 3 to 4 hours per session as well. But it is like, as we say, holistic healing, going to the core depth of what is it that is actually triggering.
There's a
Okay.
question, arsenic potency, which is the potency of arsenic albums? A question. The chat box.
Potency given was 1M. 1M
Yes.
potency with repetition 15 days.
Repetition?
15 days, after 15 days.
After once in 15 days. Okay. I think another important factor is always the attenuation. How you dispense the medicine is an important factor. That is also because the suitable dose, as the methodology advised, the attenuation as suggested by Dr. Hahnemann is a dry upon tongue. 1 or 2 pellets, size of a poppy seed, in 2 to 3 grains of sugar will crush between the index and thumb finger and gives that constituted dose. This is the minimum dose suggested by our master. But how many of us?
Usually, If
Yes,
you got to see, sir, even in organon, master has mentioned water dose to give water dose. The reason for water dose is the surface area increases when water dose is given. So usually he said preferably, if feasible, if possible, give water dose
I
because
think
the
it is
surface.
suggested when there requires a rapid action of medicine, you can dissolve in water. In the chronic disease, you can see it. Put dry upon tongue. Is in chronic disease and in moderate cases. Then again, the sensitivity of the patient is also important. The patient is hypersensitive, olfaction is advised.
And for hypersensitive, we have got LM potency.
Yes,
And,
now this is important. Yeah,
and skin cases also LM potency work. But in that, supposing if we are asking the patient to succumb, okay, like we
yes.
shake. So when the patient is sensitive, then minimum you have to shake. But when they can manage, it's fine. But if the patient is sensitive, then minimum shaking of the bottle.
That also make changes in potency, the succussions or the shaking of bottles. So that's also mentioned in organ of medicine, I think. That is the transportation. During the transportation, it can have some changes in the medicine. So I think it's better to transport the medicine in medicated form. That is the most important thing. There's a question from Dr. Sonia Soma Sharma. Please, you can, Dr. Soma, please raise your hand.
Yes,
Yes,
Dr. Sonia.
yes, you can unmute now, Dr. Soma, please.
Hello.
Yes,
Hello.
audible, please. Yeah.
Yes, ma'am. Ma'am, like you just mentioned about the succussions. So if we start, I usually learn from my mentor. I actually practice only LM. Okay. So we start regularly with only 10 as a routine. But sometimes what happens that 10 causes aggravations, and 10 strokes causes aggravation. So can we reduce it after the patient has taken after giving 10 strokes for a while, like maybe for a week? Can we reduce it? Will it still act?
Yes,
Okay.
you need to reduce because now your patient is sensitive. When you
Mm-hmm.
are giving 10 strokes, that
Mm-hmm.
dynamization which you are giving, that aura, that feel, that energy, that
Yeah.
that patient cannot handle. So we need to
Right.
reduce it. Yes, you can directly reduce it. See, 10
Okay.
steps. If you have told the patient 10, you can reduce to 5 as well. Because if your patient is having aggravation, then we
Mm.
cannot say the patient that you continue. So you need to reduce.
Right.
And one thing,
Mm.
when it
Mm.
comes to LM potency, okay,
Mm-hmm.
when it comes to that is first when the patient will be healed, when the
Yeah.
patient will be healed, there will be aggravation followed by
Amelioration.
amelioration when it comes to LM potency. Otherwise,
Yes, ma'am.
usually what we say, when I have never encountered, I tell you, homeopathic medicine is so dynamic, no aggravation has been
Mm.
encountered when it comes to giving homeopathic medicines. In my case, basically maybe the frequency with which the patient was resonating and I could comprehend was same.
Word.
That is the reason why. But if
Mm.
so, you can anytime reduce
Fine.
stroke.
Mm.
Okay, so
Yeah.
you try out this and you can reach out to me as well. If you want, we can discuss the case, the potency as well. Because see, I am doing this session here, but later
Mm.
on, when it comes to follow up, when the patient
Yeah.
comes to you, you can reach out to me. We'll discuss.
Okay.
Okay. If you
Very
want,
good.
I can write down my number on this chat
Oh,
box
yes, ma'am.
so that
Yes,
you
ma'am.
can
I'll
reach
note it
out to
down.
me easily and we will
Yes.
discuss them. And but
Yes,
I
ma'am.
hope your doubt is cleared currently.
Yes, ma'am.
Okay. Thank
Practically,
you.
I hadn't done it so far. I used to tell the patients to not take the entire glass, like 10, after 10 stroke, I usually tell them to take 1 teaspoon of the medicine and half a cup of water and have all of it. So I used to tell them if there is any aggravation to take 1 teaspoon out of that mixture and discard the rest.
Okay. So in a way you are diluting the thing. So
Exactly.
in a way
Yeah.
you are lowering down
Right,
and the
right.
activation.
So
But what
this
we can,
sometimes helps.
yes, it will help because you are
Yeah,
diluting. No, it will help.
true,
But you
true.
can reduce. There is no problem in reducing as well. If you
Fine.
feel no, see, we cannot. What was the main purpose of LM potency? Why
That each
master?
successive dose is different and higher than the previous
Basically,
one.
the thing is, the advent of LM potency was the main purpose was to reduce the aggravation. No. So if
Aggravation,
the
true.
patient is suffering, I cannot tell my patient to take 10 strokes.
Right.
Then I need to reduce it. Yes, you
Right.
did a very nice thing that you diluted it, but never
Mhm.
mind, you can even reduce it as well. Okay.
Right. Yeah. Fine.
Hope I answered the
Thank you,
question.
ma'am. Yes, ma'am. Yes,
Okay.
ma'am.
Okay.
Thank
Thank
you.
you so much. All best wishes to you.
Thank you, ma'am.
Any other questions? 0 by 1, yes. Starting from 0 by 1 is your LM potency.
I think in such cases we must think about.
Dr. Jayalalita, she wants to ask it to you. Yes, this is what you are asking, no? 0 by 1 potency is your LM potency. Starting from 0 by 1 and then higher potency in that. Okay? Sir, where is my family? I Bob sir, then Kudiat sir, where are they all? Bob sir, are you there? Can we interact? Hello?
You're
Am I audible?
Unfortunately, some network.
Hello, sir.
Yes.
Greetings
hello.
of the day. Greetings of the day, sir. Hello. How are you?
I'm fine. I'm fine.
So this was the crux of the case, sir. And the take-home message is to reach to the core, one has to zoom in. And the more the depth and more the see lateral and ectasia patient will not like probing, but to reach to the core, if the depth is understood, we can heal the patient. Thank you so much and gratitude for inviting me on this wonderful platform to share my views. Thank you. Hello. Hello. Am I audible?
Yes.
Yeah.
Okay. Okay. And may I request Bob sir, if he is there, to please come online.
Dr. Bob Lim.
Bob sir is there.
Is it Dr. Bob Lim?
Bob sir is there.
Yes, yes.
So can we have him online to interact?
Dr. Bob Lim, please unmute. Network problems there.
And Dr. Shyami sir as well. They all are my inspiration.
Yes. Yes, Dr. Bob Lim, please.
Yeah.
And,
Hello, sorry.
I would say, hello.
Sorry,
How are
I was
you?
looking for my spectacles. I was doing something else.
Okay. Okay. But Dad is waiting for you. Just a minute. No?
Yeah, it's good to.
He has
good for
conveyed
your
his
sharing
regards
today.
to you. He has conveyed his regards to you and the entire team, and he is very happy, saying that very lovely work is going on when it comes to homeopathic propagation. You're doing
Who
good,
is that?
sir.
Thank you very much for your sharing.
You all truly deserve salute for continuously and persistently taking up homeopathy at this level each day and in 3 different languages. In Hindi, in English, in Malayalam, 3 languages. I was actually, sir, I would tell you, I was just thinking if I could make it for Gujarati as well. In our local language, I will give it a
Oh,
try.
Gujarati.
So it will be blend of it. Okay, everything.
Yes.
Thank you so much for joining in. And with a short notice, you did join in. Thank you so much. Wishing you all the best wishes, sir.
Yes. The recently the India government is decided to conduct courses in the regional languages, medical courses. The regional language that will be more beneficial for the students as well as the patient. Now what happens is that the doctors are always talking in English, and the common man, they never knows it. So the communication gap is there. They cannot understand each other. So some clashes are going in the hospitals. So we hope that will be controlled in the coming days. And while discussing about the susceptibility, I think there are certain medicines suggested by Dr. Stuart Clausen, the genius of homeopathy. One is Taxomica. Around 8 to 10 medicines are there. I think the case where the patient has got some aggravation, definitely we can give such medicines, we use such medicines. With help of that medicine, we can
It is
reduce
such a great news, sir. Very nice. Very nice. I am really very happy with it.
in the just opposite of we can increase the susceptibility, we can give opium. Dr. Shaji, do you have anything to talk, Dr. Shaji?
No, actually, madam, thank you for coming to our forum. I was unable to listen to you completely. That's why I was not in a position to completely answer you. And definitely, because I am busy with some other activities. I'm in Philippines now. It is quite late here. So it is already midnight here. So I was about to retire when you called my name. That's why I enter here.
It is always a pleasure. And if you recollect, sir, last session, I told this is my family, okay? And Dhanesh sir said, ma'am, certainly you have to be there because the list of speaker in that, your name, I have already added it. But sir, you added and sent, and he was like, I know you will not say no. I said, okay, fine. My family has invited me and I will never say no for that. And in 2 days, I said, I won't be able to share this with you. No problem. But we want you as a speaker. Okay, fine. I shall be there. And this is like the zeal, the enthusiasm come when there is oneness in the family. So this I consider as my family, and that is the privilege to be in the family, and it is the respect which the family is. Thank you
Yes.
so much and keep up the good work. We are really very happy with this propagation and promotion that is going on at all the levels. And I will try my level best. If I can make it, we will conduct session in Gujarati. Let Gujarati people also. And I am planning for this laymen also, let them join. So that the main basic aim of our forum association to
Madam,
propagate homeopathy.
Madam, you share your number here so that we will take note of it. And we are planning to have even extending our session to 24 hours globally so that
Oh,
every different language, different countries will be included. It is a big thought in our mind, and so that we will be able to daily having 24 hours program. It is in the dreams. One day it will definitely come true. So we'll definitely consider Gujarati also in our plan. So
thank
just
you
share it.
so much.
We will keep in touch with you.
It would be like this radio meeting, FM, sort of.
Yes, Dr.
And
Dhanesh.
24 hours, it will go podcast time in Hindi, English, Gujarati, and Malayalam.
Because this will send shockwaves to Dr. Dhanesh because he is already suffering for 3 hours for the last 2 or 3 years
So
continuously. Dr. Dhanesh,
that is
please.
that is the beauty of joining in many people, different ideas, and all clubbing into one, and and the entire team working towards that selflessly. The main thing to underline is selflessly because we have got ample groups as well, but working selflessly is the main prize.
Yes, Dr. Dhanesh, please.
Yes,
Comments.
thank you, Dr. RAKSHA THAKKER, for an excellent presentation. And definitely, we are very happy to have such sessions in different language because we are connecting one another in all respects. The international session in that is the Hindi English session really bring doctors from different part of the world together, and all of them are supporting us in just like what you told here. There are groups in Turkey, then USA, UK, everywhere we have our people working together and running their short discussions every time, and they are joining in group. Last time you may be remembering in our 1000-day celebration, we have a 30-day celebration, and each day was dedicated to each country, one country, and we never expect that much of countries have so much of resources with them, and they come out with full our presentation with the 5 to 6 people, and sometimes at 9 people, doctors from their country joining and presenting cases here. That was such a beautiful thing that happened in our 1000-day celebration. And there was, believe it or not, there was 24 hours, 48 hours Zoom-a-thon was there. Dr. Shaji Pudi was always awake during that 48 hours session. In those days, we were not much, we were not having so much resources with us. But Dr. Shajikudi was full alive throughout 48 hours. That was his dedication, and that's how this IFPH forum is running. Nowadays, we are able to upload our videos every other day itself, so that it reaches more people every day. And Dr. Hubert and Dr. Ankumar is doing great work in that also. So that our team is working, whether Dr. Danesh, Dr. Manoj, Dr. Shaji Puri, it is not a matter of person, but we are one, the same people, all people have the same mind and same heart and same brain. That's why we are able to work in such a way. Then we are lucky to have Sahani sir in our team to lead us now. From the friend, sir is doing great services in bringing more doctors of international caliber from India itself, as well as from outside India also. So all these things are going in a beautiful way. So we appreciate you, the support you are given by you people are also here. And but what we want is that we at least within 1 hour, our subscription to YouTube channel need to be raised to at least 10,000. Already it has reached more than 5,000, but we would like to have more people watching our videos. Then only the promotion, that is what we are, our purpose is fulfilled.
Yes,
So thank you
Dr.
for.
Ganesh. In India, there are around 3 lakhs homeopathy registered doctors in India.
Yes, exactly. There are more than.
So that itself indicates how much they are losing.
But the thing is that
Only
most of them are
5,000
not.
watching these words of these masters among 3 lakhs.
The resources are available. Resources are available, but it is up to us how much we use it. So we have ample opportunity, but the resources are also available. Now it's our capability and our main teamwork, which will get us to this great.
Yes. Anyway, Dr. Shaji
Basically,
Puri now reached a state of nitric acid or cocculus from long-lasting loss of sleep for the last 4 or 5 years. He is suffering from the chronic loss of sleep. Maybe some symptoms may be there, Dr. Shaji.
Yeah, it is a dedication and it is a passion and it is the mission that we all have, because this medicine deserve it and because the humanity needs this medicine where suppressed by the people who are not pro-human. So we need to bring this to the level where humanity will be benefited from this medicine, and that is duty and responsibility all of us who came to understand this whole. So it is a big mission that we need to achieve in our lifetime. So with that much dedication and that vision and mission in mind, this association was created and
So
exists.
for this, the well-documented cases, when it comes to pathological and well-documented audio, video, then the reports, all have to be well-documented. The thing is like that we are lacking. Where is this file is negative? Then if it is well-documented, then presentation and so that even when a layperson asking about homeopathy, we can show them with evidence as well and make them aware at the level at which homeopathy works.
So we are encouraging, we are elevating the capacities, potentials, and presentation abilities, recording abilities of homeopathy is around the world. Who are low inspired were able inspired and even able to start new courses in homeopathy in many countries, including South America. So through the works of continuous dedicated activities, we are able to inspire and elevate homeopathy in many countries, not only in India. And that is a big achievement.
Okay. My request is to you, Dr. Raksha, that you should bring young talented persons to this platform. That is here the average age I think around more than 50. But we want fresh bloods to this group, so they'll benefit and the homeopathy and the convent benefit. Time to wind up session. May invite Ram Barvesh Shah, one of the senior physicians. Sir, express a lot of thanks, please, sir. Yes. Yes, sir.
Thank you, Manoj and our congratulations, our Raksha Thakkar madam,
Thank you, sir.
and Namaskar, Dr. President, Vice President, Dr. Shahji Courier, and Dr. Dhanesh ji. Everyone, good evening. Very nice presentation, madam. Congratulations. Dynamic lecture and dynamization. Treatment is dynamization. Dynamic. So very thanks.
The name itself, homeopathy is dynamic, so lively, it is so energetic.
A main cause of disease is dynamic, and treatment, homeopathic medicine is a dynamic, or dose is a dynamization, 50 millismol scale, water dosage. So very thanks, madam.
And the feel is such that it has reached all
IFPH, whole team.
and
Very thanks. Again, presentation. Thank you.
Okay.
There is an announcement.
Yes, please.
Thank you so much.
There is an announcement for
Yes, Dr. Dhanesh,
I
please.
promise you will get the same happiness in session with my friends also. All are there in the list, okay? So I am cooking them. We will be having more speakers.
Okay. Tomorrow we will have a session from Dr. Shweta Singh. The subject of discussion will be substance use disorder and homeopathy by Dr. Shweta Singh.
Okay, with that, let me conclude today's English edition. Hope you that will be back again tomorrow. Till then, goodbye. And Dr. Mariama John to continue the program in Malayalam. Thank you.
Pleasure, sir. Pleasure, sir.